Let's talk about what to expect. Hey friends, welcome back to my channel. If you are new here, my name is Gail. I'm a family nurse practitioner and nurse educator, but also your go-to mentor for surviving and thriving in nursing school. Today we are talking about something super exciting and honestly a little nerve-wracking as well. Your first clinical rotation. So if you are feeling nervous, overwhelmed, or unsure about what to expect, I've got you covered. So I'm going to walk you through exactly how to prepare mentally, academically, but also practically for your first clinical experience. But use this advice to apply to your other clinical as well. Sorry for my voice, I've been sick, okay? But I have to come back here and give you guys the content you've been asking for. So I'm also going to share some of my own personal tips from when I was a student and what I now tell my own students, my own nursing student. So grab a notebook and let's dive right in. First thing first, let's talk about what to expect. Your first clinical rotation is often in a long-term care facility or med-surg unit. But we want you to apply those health assessment knowledge with those populations first before moving on to the most acute patient. So depending on your program, some will start in a long-term care facility, others will go straight to a hospital. So you are not expected to know everything, trust me, but you are expected to show up prepared, professional, and ready to learn. So usually your responsibility will include the basic patient care, vital signs, bathing, feeding, charting, and maybe give oral medication under your instructor's supervision. Never give medication with the nurse on the unit without your instructor. So you might also shadow your nurse preceptor or assist with procedures, okay? But for your first clinical rotation, please consult with your instructor. Don't stress. If you are not doing IVs or folic acid on day one, you're gonna have all your time to practice those skills. Alright, now let's talk about mindset. You are going to feel nervous, that's normal, but you have to shift your mindset from I don't know anything to I'm here to learn everything. Go in with a teachable attitude. That's very important. Be humble and ask questions and also take initiative, okay? So even if it's simple, like offering to check vital sign, turn patient, restock supply, please do it, all right? Nurses notice the student who try. And when you do that, nurses on the unit will be more friendly and then they'll be grabbing you to show you more stuff because they know you are eager to learn. Remember that not every nurses will be welcoming. I also talked about it in my previous video. Go watch it, okay? I'll make sure to maybe pin it at the end of this video. Don't take it personally. Stay focused on your growth. You there to learn, to master your skills and grow as a nursing student and a future nurse. Let's talk about what to study before clinical. Here's a quick checklist on things you should brush up before day one of clinical. Your vital sign. You have to know the normal range and what is abnormal, and your heart rate, your blood pressure, and also add on to that blood sugar. And know your basic assessment skill, and that is why before having your very first clinical, you most likely gonna be taking a health assessment class. Know how to listen to lung sounds, heart sounds, all that stuff. Know the common medication, especially if you'll be giving medication during your clinical. Some schools don't allow you to give medication in your first semester or your first clinical experience. However, if in your program you will be expecting to give medication, please know your drug classes, your side effects, and also why the patient is taking this. In case you are new here and just found me through this video, I've been a nurse for 8 years. 8 years. I've been teaching nursing for 5 years, and I've been a nurse practitioner for 3 years. As a RN on the floor, I give my medication by saying, hi, my name is Gail, I will be your nurse today. I have your blood pressure medication. Do you have any question? They'll say no. Then I'll say your blood pressure in this morning was 140/80 or 140/90. You know the normal blood pressure is 120/80. So we want to keep your blood pressure under 120/80. You see what I mean? So you, that as you're giving your medication, you also educating the patient. That's the key. You learning as you are doing it. Also ADLs, activity of daily living. Things like helping patients to toilet, feed, dress, and bath. So you don't have to memorize the whole textbook. So refresh your basics so you can feel more confident going in. Now let's talk about what to bring in your clinical bag. Well, first of all, your school ID badge and your uniform. That's a must. In my school where I teach, if a student show up in a clinical setting without the ID badge, I have to send the student back home, and that is a no-call, no-show. You know, so it's really a must for you to check your school dress code. But also, don't forget to bring your stethoscope. You have to invest in a very good one if you can, because I know you're a student, you're just starting, but I know some brands have a good one starting at $75. So please, if you can, invest in a very good stethoscope. It will help you count. Bring a watch, right? A watch where you can read the second. This is important when you have to measure the patient heart rate. If you can, bring a pen light for your eye exam, black pens, you know, to write your findings, small notebook, of course, or clinical brain sheet for patient notes. This is very important. When you receive a report from a nurse, you want to be able to take notes, right? As you grow in your role as an RN, you find what works best for you. Some nurses take notes in a blank page and they write everything in there, but other nurses, they have their own clinical brain where they have like vital sign, clinical. So as you grow in your role, you find best what works for you. Snack and water bottle if needed, in case you go for clinical for 12 hours and you need to stack on, you can bring those as well. Also, please wear comfortable shoes. Check your program dress code, because some of them requires, I think most of nursing students don't want to see any toes. Check your clinical dress code for that, but please make sure you wear comfortable shoes. You will be on your feet most of the shift. If you are in my class as an instructor, I don't like to see students sitting down in nursing station. So here's what I tell my students to do on the very first clinical day. Arrive early. Being late creates unnecessary stress and gives a bad first impression. So when you come, introduce yourself to your nurse and the staff, okay? Something like, hello, my name is Gail. I'm a nursing student from, okay? I am excited to work with you today. Make sure to be respectful, attentive, but also present. Try your best to stay off of your phone unless it's for clinical purposes or family emergency. Take notes on anything you don't understand so that you can review it later. So when I take my student to a clinical rotation, I have a post conference when I ask them what they learned, what type of question they have based on the experience of the day. So that's when the students ask me questions or they share their personal experience that day. Make sure you take notes so that you can address those concerns if you have any to your nursing instructor. Also, if your patient is comfortable, ask to practice your assessment or help with care. But don't forget to consult with your nursing instructor about what you want to do with the patient. But most patients love being part of your learning experience. Okay, they will let you do anything. If they have wounds, if it's not too painful, they will let you change the dressing. Just ask, okay? Just ask. And finally, thank your nurse at the end of your shift, because gratitude goes a long way. Listen, you are going to make mistakes. You might even forget how to take a manual blood pressure or get nervous and blank. You don't know what to say in front of the patient. But let me tell you that it's okay. What matters is how you respond. Ask questions on your own mistake. Nobody expects you to be perfect. They expect you to be willing to learn. I truly hope that this helped ease your nerves and give you a clear idea of how to prepare for your very first clinical rotation. And please remember that clinical are where you connect the dots between your classroom knowledge and the real life nursing. Take notes, ask questions, and soak it all in. You've got it. You've got it. So if you found this video helpful, give this video a thumbs up, subscribe for more nursing school tips, okay? And if you have already had your first clinical rotation, please comment below and share one thing you wish you knew before starting, okay? Thank you so much for watching, and I'll see you in the next one. Bye bye.